Hello, everyone. This is Marcia Sawyer. This is my last regular class before practicum. I have been in this program since the beginning of January 2024. So part of me is excited because we're getting closer to graduation. And then there's a part of me that's nervous because practicum is just around the corner. In regards to the COVID-19 pandemic, it was my first pandemic that I had ever experienced. And what was really good was not good, but in perspective, what was good for me was that I had just began my bachelor's program for public health. And so seeing the data and the classes I was taking at the same time the pandemic was going on was kind of awe. I'm like, I was just in awe of public health, like the tools that the public was being recommended to use, such as distancing and wearing masks, quarantine, were all initially created during the Spanish flu of 1918. So seeing that on paper and reading about history and seeing it play out in real life was definitely an interesting thing for me. Um, Personally, it was nerve wracking in the beginning, not knowing what was happening, but also being worried about my loved ones, not in the United States to begin with, but in my native country of Sierra Leone, because we had experienced a couple of pandemic, including the Ebola pandemic, and during that during that pandemic, it wasn't taken, the right actions weren't taken quickly. And so my fear was that due to the lack of public health infrastructure and healthcare services that were in the country, especially in the rural areas, that there would be more deaths. I'm glad to say that that didn't happen. Our officials, our public health professionals, medical care team, even the government stepped in quickly. Sadly, in the United States, that did not happen. Sadly, people used the pandemic to they use the pandemic to go after public health in a way that was just so wrong. Um, People lost their lives because there were misinformation and not right information given to the public about what they needed to do to protect themselves. I think public health officials were doing the best they can. There's a saying we have in my work. I worked at PPP for a while and Paycheck Protection Program, and we used to say that we were building the plane as we were going, and that's the same truth for public health and for healthcare, right? As we are learning what we need to do, as we're doing more research, as the research becomes more available, and then we change course or we make things better. And that really was what was happening for the COVID 19. Everyone was on hands. I knew people who were working long hours and not being able to be home, take care of their families. So that was just, it was saddening to me. It's saddening to see that there are people who um, didn't listen, and so many people lost their lives. On the other hand, it was good to see that what public health officials had been talking about for years and decades earlier regarding a possibility of when, not if, a pandemic was going to happen again, that these research and what we're learning and studying, they predicted it was it's and so for me in the future, I think that especially now when we're uncertain times and public health infrastructure is being decimated in the United States, and that the country has chosen to separate itself from World Health Organization, that we need to. It's sad. It's sad to watch it, and I don't know what else to say about that. But in regards to the pandemic, personally, I didn't lose anyone directly, but around me. I actually had a neighbor who had it, and she's the best person on the earth. And so, having a medical background, having being able to help her as she was going through the symptoms was really um, a good thing because I was there to help her go through that. Um, we did the best we could with what we had in the United States, but I think that our government officials should have taken steps sooner. And I think that correct information and that they shouldn't have attacked public health officials, professionals who were doing the best they could, especially that they were learning about about this virus as it was happening. Um, yeah. So I wish everyone the best in this class, and I hope your journey is getting shorter and you're getting closer to graduation, and maybe we can all meet at commencement ceremony. Enjoy the class and have a nice day. Bye bye.